Initially, we had this health emergencies in the Western province because of the extreme drug resistance and multi-drug resistance and that. So there was an initial project to establish a center of excellence for TB control in the Western province. And that was because of the good experience learned there. Our high incidence areas of provinces for TB is NCD, Western, Gulf, around the coast, along Western province as well as NCD and Central. So that's how the project was negotiated under the World Bank as an emergency loan as part of also COVID.
In 2023, more than 42,181 TB cases were reported to the NDOH, an increase of 15% from 36,644 cases in 2022. We commenced the Emergency TB Response Project supported by the World Bank. The Emergency TB Project in NCD, through systemic screening interventions, SSI, had led to detecting large number of TB cases early, treating them early, and reducing TB transmission.
This project contributed a lot towards achieving the national indicators. First of all, for any country in the world, for them to successfully control TB, they have to have a treatment success rate above 85%, meaning 85% of the people with TB that you treated must successfully complete treatment. That means at the end of the 6 months, they must have no TB. With this project, once we started the emergency TB project, the treatment success rate in NCD actually picked up. And it's gone above the 85%. Now it's around 90% and above. And the treatment loss to follow-up rate dropped actually to below 5%. So we have seen that this project has contributed to the achievement of national targets for TB, both for case detection, that means finding TB cases, and also the indicators that we normally use to measure the treatment success rate. Also, we have noted that the achievement in NCD, as I've mentioned earlier, was even above. The NCD achieved targets above the global TB targets. And also about the regional TB targets. So we've seen that these projects contributed to achieving national and global TB targets. Also, this project contributed to finding more people with drug-resistant TB. The treatment success rate on drug-resistant TB is actually not good across the country, but under the emergency TB project, it has actually improved for both NCD as well as in Daro. So we've seen that this project can contribute to achieving national indicators.
So this project is about helping reducing the burden in the city. So that's one important support that come through. But also the project help us to strengthen our diagnostic capabilities by giving us GeneXpert machines that we didn't have. So we could have machines there to test people with GeneXpert meshing. Also, it helped us to improve our diagnostic, like having X-rays. In Port Moresby, before we used to have everyone goes to POMGen only, because that's where all the X-rays were. But through this project, we now have 3 locations where we have X-rays, like 6 Mile, Gerahu, and Lost Road.
When it comes to TB program, we need to do active case detection. We need to do follow-ups. We need to do direct observation when the patients are being treated. We need to do contact tracing. All that requires a lot of work. So we need partnership from everyone. It's the department's responsibility and the government's responsibility to buy their drugs and then bring their drugs into the country. And it's the department's responsibility also to make sure the facilities are working. But when it comes to awareness, identifying cases, informing everyone, but we need support. We need support from everyone.
One critical thing we've seen in SSI is the community engagement, and it's stepping outside the system of the health system. It's now engaging the community. You're looking at community leaders, you're looking at young people, and what SSI has done is it's really been able to work collaboratively with these groups to now make it everybody's business to address TB in their communities.
In NCD, most of the patients are from the settlements. So from experience, I see that engaging and involving community or encourage them to participate in TB activity, we will reduce TB burden, and also it will help us to identify more cases.
On behalf of the community, as a youth representative, we do thank you, Loibla. Thank you, long this initiative where Ibla team long come na support yung community around the Port Moresby City. Mi blogata long community long Moresby South. Mi bla thank you, Loibla. Mi blogata benefit through the program.
Okay, the momentum to end TB in Papua New Guinea requires commitment from all levels. It starts from high-level political commitment, including the government. When I talk about government, I'm talking about not only the Department of Health, but also other departments, other ministries, because TB is not just a biological disease, it's also a societal, it's an economic disease, it's a disease of social issues. So it requires multi-sectoral collaboration.
And this project has come timely, really, to deliver the World Bank funded 15 million investment since 2017. And one of the components it is being showcasing in NCD is really active case filing, where we are arresting early detection of cases and identify people who are positive and put them on treatment. And we are finding that this is yielding some good results, and the department is gaining a lot of investments in terms of understanding the community, the hotspots, and the people out there who really need to have the understanding about TB. And with all this investment, we don't want to leave anybody behind, and the government is putting all its resources together to make sure that we save life in our communities.